the beekeeping world, there is so much mystery surrounding honeybee viruses. So I'm going to do a little bit in this video, I hope, to demystify honeybee viruses. And when I was considering what to do with this video, it was actually a difficult decision for me. I could have gone virus by virus and talk about everything that each virus does. But honestly, there's not a lot known about viruses that we can act upon as beekeepers. So I'm going to squeeze a lot of virus information into some really brief nuggets of information that I hope you can use as a beekeeper as you're trying to understand viruses and their impact on colonies. I'll just start off right out of the gate. There's really nothing available to control viruses yet. There's a lot of researchers who are out there who are testing different things to control viruses. I hear about promising things all the time, but control is going to be difficult. But nevertheless, I'll give you some ideas about virus control later in this video. So I want to start by talking very broadly about viruses. So honeybees can get viruses a lot of different ways. They can pass it to one another. They may be able to inherit from their mother. Queens might pick it up from drones when they mate. They might get it from varroa, a mite that feeds on their bodies. There's lots of ways that they can get it. And again, there's lots of viruses, with new viruses being discovered associated with honeybees every year. So to help you think about this, I'm going to try to break this down into sort of three categories of viruses. The first of those are viruses that affect brood. The second category would be just general viruses that affect adults. And then that final category is not really a category, it's just a specific virus that I want to spend some time on, and that virus is deformed wing virus. So I'm going to start first about the brood viruses. There are two main brood viruses that beekeepers are going to have to worry about in their colonies. The first of those is sac brood. The second of those is black queen cell virus. Let's take the first one first. Sac brood, like the name implies, is a virus that kills the brood and turns their body almost into a sac of liquid. So it's officially called sac brood virus. And it's very similar, at least it presents very similar to American foul brood. It tends to kill cap stages of individuals, either older larvae or those pre-pupae. And what it does is it can cause sunken cappings, perforated cappings. Again, things that you think of when you think American foul brood. It's just that when you open those perforated cappings or those sunken cappings, you'll see a discolored individual in that cell. It's not pearly white like it should be. It's brown or orange or yellow. And you get some tweezers and pull up that developing pre-pupa that's now dead. And if you notice, especially in late stages of death and decay, there will be a fluid-filled area at the bottom of that individual. Again, the skin, as it were, of that developing bee becomes sac-like and tough, and the inside of the body just melts as the virus replicates, and you get this sac of fluid. It can be very difficult to distinguish from American foul brood. Again, sunken cappings, perforated cappings, dead and diseased, either older larvae or pre-pupae. All of those things are similar things to what you'll see with American foul brood. One of the key differences that people will look for with sac brood is they'll do the rope test where they'll stick a small stick in the cell, stir the contents around and pull it out, and you don't really get that ropey string that comes out with sac brood like you do from an American foul brood killed developing bee. So sac brood is one of those things that you're going to see. It tends to pop up in times of stress, which is what a lot of the viruses do, as you'll see. The second brood virus is black queen cell virus. What it does is in the name. It turns developing queens black in their cells. So what happens is these immature queens will get the virus. They will die as usually that kind of pre-pupa pupal stage or those older larvae, and their bodies turn black. So the queen cell will fail to hatch. You open up that queen cell and you'll see that black rotting individual there. And that's a good indication that black queen cell is responsible for what you see. Incidentally, at least in the United States, black queen cell virus has a very broad distribution. It seems to be in a lot of colonies, in a lot of places around your apiary. So at some point as a beekeeper, if you keep bees long enough, you're going to see black queen cell virus and sac brood virus infecting bees in your colony. So that's the brood viruses that people most think about when they think about viruses. That second category then would be the adult bee viruses. And of course, deformed wing virus, that third category, is also an adult bee virus, but I'm going to put that one to the side for a second and focus on this other pool of viruses. I've already alluded to earlier in this presentation that there's lots of viruses that bees get. I could have made 20 or more videos about each virus. Viruses that affect adult bees: acute bee paralysis virus, chronic bee paralysis virus, Kashmir bee virus. You get Israeli acute paralysis virus, bee virus X, bee virus Y, Varroa destructor virus A, Varroa destructor virus B, iridescent virus. So many viruses that can infect adult bees. And so I'm going to speak very much in generalities here, but the adult viruses often produce the same signs of infection. Those signs of infection, often, though not always, are hairless bees. Their hair will come out, and that causes the bee to have either a shiny or a greasy appearance because you're seeing it without hair, so it can be very dark, shiny, or greasy. It often can cause what we describe as this sort of rigid paralysis, where the bee will be standing on the comb and not moving. It's hairless and not moving, or if it is moving, it's just shaking back and forth because it's so infected with virus. That's a sign of infection it presents. Adult bees that are heavily infected with viruses often crawl out of the nest in a system of altruistic self-sacrifice. They're sacrificing themselves potentially for the greater good of the hive. They'll crawl out of the nest, and you'll often see these hairless bees crawling around on the ground or crawling up blades of grass. So all of these are signs of infection for general adult bee infections. There are some other ones where you can look at the hemolymph or the wings or things like that. But in general, when you see hairless bees, when you see greasy or shiny bees, when you see bees crawling on the ground outside the nest or bees on the combs shaking, these are all indications that you have an adult bee virus in the nest. So that's the second category. The third category, which is also an adult bee virus, would be deformed wing virus. And the reason I pulled it out is to highlight how important it is to beekeepers and bee colony health. Deformed wing virus, like the name implies, leads to deformed wings on the adult bees. Deformed wing virus is spread by Varroa destructor. It's a mite that goes into the cells of developing bees. It'll go into a cell, go up under a developing larva. The adult bees will cap over that cell. The mite will come out and start feeding on the prepupa in that cell, begin transmitting viruses to that developing bee, and that viral load that builds up in the bees leads to malformed or deformed wings when that bee emerges out of the cell. If you see lots of adult bees in your nest with crinkled, missing, twisted, misshapen wings, they probably have a high infection with deformed wing virus. And the reason I wanted to pull it off to its side, because it's so common. It is almost everywhere Varroa are. So if you struggle with controlling Varroa in your colonies, you're going to see deformed wing virus frequently in the nest. You're going to see the manifestation it has. Now, I've spoken about things like deformed wings with deformed wing virus and this greasy or hairless or shaking manifestations of these clinical signs of infection with these other viruses. Almost all of the viruses also are known to shorten adult bee lifespan. So you might be losing bees before you ever physically see the clinical signs associated with these viruses. By the time they're crawling around on the ground outside the nest or losing their hair or have deformed wings, even the adults that aren't showing this may have shortened lifespans. So viruses can be a significant problem in the nest, and you've got to be able to recognize kind of which of those categories you have. But unfortunately, recognizing which category you have doesn't always lend itself to being able to control. Remember, at the very beginning of this video, I made the comment that viruses are very difficult to control. That is true. So I'm going to give you some very broad recommendations that can help. But until we have much better ways to pinpoint individual viruses and do away with them, there's just general recommendations I can give. Recommendation number one, control everything else you can control. Keep beetle populations low. Ensure the nutrition is good. Make sure you have a good queen. Control Varroa. More on that later. Any stress that's in your hive can make that viral infection potentially worse, and you'll see this kind of manifestation of viral problems when they may be intimately linked to another stressor in the nest. So control the stressors you can control. I want to pull out from that comment this idea of controlling Varroa. we know Varroa transmit deformed wing virus, and they are probably responsible for transmitting a lot of the other viruses in the nest. People are discovering more and more about this all the time. So a great way to control deformed wing virus specifically, but a lot of these other viruses potentially, as well as keep your Varroa populations in check. They must be under control. If you keep your Varroa populations low, then often you don't see these clinical manifestations of these signs of infection associated with viruses in your nest. So control Varroa, and in case you didn't hear me, control Varroa. The third recommendation that I have for you is to requeen colonies. Unfortunately, this is kind of one of those generic recommendations when you have this problem in your hive that you can't otherwise fix good ways. But if your bees are showing clinical signs of these viruses, then they're clearly susceptible to them. So consider using a different stock or requeening or giving that hive bees and brood so maybe they can pull themselves out of that infection. Again, I could have made a 3-hour-long video about all the individual viruses, what they do to your colonies, etc. But it's really important to remember the brood viruses. Sac brood virus, black queen cell virus. The biggest problem with sac brood virus is you're going to think it's American foul brood, so you really got to separate those two. Black queen cell virus might take out some developing queens. Second category, adult bee viruses. Greasy appearance, shiny bees, shaking on the comb, crawling on the ground outside the nest. That third category, deformed wing virus. These are the things that you're going to notice as a beekeeper, and requeen, control stressors, control Varroa, improve nutrition. These are the best tools that you have in your arsenal to minimize the impact of viruses on your honeybee colonies.